Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. I'm so glad you're joining us. We'll be diving into the topic of choosing the right doctor, a decision that can make all the difference in your healthcare experience. Today, we're thrilled to be joined by Dr. Joy Gianvittorio. With over 25 years of experience, she's passionate about supporting patients on their health journey and empowering them to make informed medical decisions. A resident of Hampton Roads for over 20 years, Dr. Joy treats patients of all ages, specializing in both chronic and acute primary care conditions. Thank you for joining us.
Thank you.
I think we can all agree that having a healthcare provider who truly knows you is such an important part of building a strong, trusting relationship. But where do we begin? For those of us trying to navigate the sea of doctor options, where should we start? It's very overwhelming. What are the first steps patients need to consider when selecting the best provider for them here at TPMG?
This is a tough thing for many patients to feel. Most good relationships are based on trust. And so until you actually meet someone, it's hard to figure that out if you have good trust. Doctoring actually means teaching, not so much caring, but the word doctor means to teach. So you have to have a good relationship to have shared decisions within a visit. And so meeting somebody for the first time, I think, is very important. Sometimes it's a little hard when people are rushed and doctors are not taking new appointments. But trying to dig through online presence, whether it's blogs or video or whatnot, can certainly be helpful. And of course, word of mouth in our area is also very important.
Could you share a bit about TPMG's approach to patient care and what sets us apart?
TPMG, in my opinion, and in many people's opinions, is the best medical group in the area and probably one of the best medical groups in the country. It was started by primary care doctors who wanted to maintain autonomy in practice. And because of that, all the decisions that are made financially or with real estate or caring for patients is all done by physicians. Physicians are owners, physicians run the board, and administration that helps us run practices are following policies that have been set by physicians.
A lot of people don't know TPMG is physician owned. You know, we have a lot of medical organizations in this area, and TPMG is kind of the underdog. What do you love about working for TPMG the most?
Oh, it's absolutely the autonomy. I can care for patients the way I feel like I need to care for patients. And when I came to interview for my position, it was kind of very spontaneous. And I always say that I got very lucky when I came in and I realized that this model was exactly what I was looking for. Autonomy is very important because it helps. You're not being told by somebody else on how many patients you need to see or how much money you can't spend on certain things. And so happy physicians and providers usually means better care and a better relationship with your patients.
Even with the best intentions, many people make mistakes when choosing a doctor. It's important what to know to watch out for to ensure they're making the right choice. Can you share one common mistake that patients often make and any advice on how to avoid it?
Thankfully, in this day and age, it's much more acceptable to be your own advocate. So I think sometimes patients are not their own advocates. And, sometimes it was like the relationship with doctors, generations ago was the doctor said whatever and you followed it without question. And now that's just not acceptable. It has to be a shared decision making. So sometimes patients are nervous or they haven't done any research or they just don't feel comfortable because it just was never done that you could question, the services of the practice or the healthcare of the practice or the education of the practice. But people do need to be their own advocates. And so they may need to do a little pre-visit preparation of what they want to accomplish and questions that they want to ask. And so going into a visit where many times the physician or the provider is rushed, it may feel invalidating. And so when patients do their homework and come in prepared, that usually is extremely helpful.
Absolutely. And once you've got the right doctor, the next step is making the most out of your appointment. Like you said, preparation is essential. What are some practical tips for patients to ensure that they get the most out of their doctor visits at TPMG?
I get some of this from my own experience with my own healthcare, as well as seeing patients. Sometimes I chuckle and think, how in the world did I ever practice before I had this condition, or before I went through menopause, or before I ever had a child? Like, it's kind of a joke. Patients, again, need to be their own advocates and prepare. I will be asking, and the nurses will be asking, are you taking your medications? So it's good to know what medications you're taking. It's good to have a list of those things, and be honest with us. We're not the police or your parents. We want to know, yeah, sometimes I do miss my meds from time to time, or sometimes I can't afford them. I mean, that's okay. We understand those types of things, and we're busy people too. We're parents, we're caregivers. If you can't get in because you couldn't take off from work, or maybe you got sick and had to cancel, like, it's okay. And again, patients need to be their own advocates, but being honest and having a good, healthy relationship with their physician is a very good idea.
Yeah, I was always told you got to be honest with two people in your life, your doctor and your lawyer.
Right.
Well, for new parents or parents of young children, what advice do you have about navigating the healthcare system and maintaining their child's health during the early years?
Yeah, this is extremely important. And, with social media just taking off, and there's a lot of new opinions about healthcare for children, healthcare for adults. It's complicated, and I completely get that. I respect it. Of course, having a good relationship with your primary care physician is extremely important. And the beautiful thing is that Holland Road Family Medicine has been in practice for 47 plus years. And so we have many, many generations of patients that come and bring their young families here. So that's a blessing for our practice here. And it's an honor to take care of patients that have been with the practice for a very long time. But if you're trying to find a correct physician for your child, or navigating a different type of office, still just being an advocate and putting some trust into the system, but also, it's okay to be involved. It's okay to ask questions. It's okay to question things. And, you want the best for your children. So that makes it complicated, but many of us are parents and we understand.
You mentioned earlier there are many people that rely on advice of the internet, friends, family. There's a lot of things out there. Everyone has an opinion, right?
Yes.
It can be hard to tell the difference between good advice, bad advice, especially with so much floating around online. How do you help patients sift through all that noise?
Well, we do. That's our job. Many, many years ago, it was a little alarming when patients would say, well, I was on Google and I found out this. But my opinion is that's no longer discouraged. I think it's good to have patients that are educated and have good questions. Part of it is directing patients towards what good information is versus what questionable information is. And so sometimes just showing where websites are good, and that maybe are linked to health systems, versus what you may find on a Reddit string that may not be the safest thing, or what's on Twitter that can get a little bit crazy. But again, we're here to teach and guide, and doctors, our job is to promote good health long term. So it's good to have that discussion.
Managing chronic conditions often require specialized care, but as a primary care physician, you play a key role in overseeing your patient's overall health. How do you approach managing chronic conditions in your practice, and when do you determine it's best for the patient to be seen by a specialist for more treatment?
Chronic care management is our bread and butter in primary care. So it's something that I was trained to do, and I've been doing for, 20 some years. I think our job is to help patients understand the long view. And, the goal is to reduce the risk of chronic illness like heart disease, like stroke, like cancer. And so sometimes patients may feel overwhelmed when we want to manage blood pressure as well as we can, or diabetes as well as we can. But doctors know what happens with patients that have uncontrolled diabetes at a young age. It means they have a higher risk of heart attacks in their 50s and 60s, and higher risk of amputation or kidney failure and dialysis. So our job is to try to help give people the big picture, and then break it down into, this is what's expected for you, as you get older. Sometimes things just get complicated, and we know that there may be a chance that medications need to be managed a little bit differently with high blood pressure and diabetes as kidneys start to age and fail. And so Seeing a kidney doctor may be appropriate in that situation to help with some medications. Or sometimes mental health care is not going in the right direction. And we have tried several medications and the patient's symptoms are not better. So referring to a mental health specialist or a psychiatrist is many times the right option. Every specialty is like that as well. So it's something that thankfully we have a lot of specialists in our area, and TPMG, of course, has wonderful specialists. So it's good to collaborate with care that way.
Well, what advice would you give to someone who feels overwhelmed by the idea of taking control of their health?
Yeah, this can get overwhelming, especially if an event happens and suddenly you meet someone that either you haven't seen for 5 years or you know their spouse, but they haven't been able to bring their other spouse in and something happens. So again, you have to give them the long view and break it down. Our goals long-term may be reduce the risk of recurrence or reduce the risk of having a heart attack or something. But short-term goals is one day at a time. And so I tell patients, maybe you want to start exercising, but you're not going to suddenly be an athlete in the gym in a week. You may just want to put it into your head and plan it. And then maybe the next step would be walking around your house and going up and down your stairs a couple times a day, and maybe do that 3 days in 1 week. Once you start hitting that goal within a couple of weeks, it becomes more habit. And then you can take the next step of, well, maybe I'm going to buy a bike and start biking, or maybe I'm going to join a gym or join a dance class or something. So, you don't have to be a gym rat and an athlete to have exercise or mobility. And so approaching things like that, talking to them about medications. Okay, nobody wants to start a med. Nobody wants to take a pill every night. So at some point you'll accept, that you're going to have to take this blood pressure medicine on a regular basis. And it's okay that you don't want to, and it's okay that, you're really not sure about this. You don't feel like you can remember, or you don't want to do it. But it takes some time, and it may not all happen with that first visit.
And taking control of your health doesn't mean making huge changes all at once.
Right.
Well, before we wrap up, is there any final advice you'd like to offer to our listeners who are looking for a new healthcare provider or aiming to get the most out of their doctor visits?
Yeah, it's great to have a relationship with physicians. And I think it's extremely important that your family has a relationship with a primary care provider, because PCPs are overseeing everything. I used to tell patients that we were like the quarterback of the situation, kind of like looking at all the plays. But really, it's more of, some people say the defensive coordinator, some people say it's the offensive coordinator, but it's a big picture view of your overall health. And you may not need primary care physicians right now. You may need them once a year. Or even every other year. But there may be something that happens that you do need to have somebody. And if you wind up in a hospital situation or an injury and you don't have a primary care physician, that can lead to delays in care or bad outcomes. So it's always good to have that. And then, you can always have your primary care physician guide you as far as different types of specialists that your family may need.
Mm-hmm. Well, thank you so much for joining us, Dr. Joy Gianvittorio, or people will call you Dr. Joy.
Yep.
Thank you for sharing your expertise and insights. A big thank you to those for tuning in to this first episode of TPMG Health Talk. We hope you found this conversation helpful as you navigate the important decision of managing your healthcare visits. Remember, when it comes to choosing a healthcare provider, TPMG is here to support you with a dedicated team of experienced doctors ready to meet your unique needs. We're here to help you achieve your best health every step of the way. If you have any questions or would like to learn more about TPMG and how we can support your health journey, be sure to visit mytpmg.com for more resources and information. And don't forget to subscribe to TPMG Health Talk. Join us next time for more valuable advice from our trusted medical professionals. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.